All right, wonderful. Thank you guys for joining us for our third webinar in the series for serving individuals with criminal justice involvement. Want to quickly introduce myself. I guess I could turn on my camera. My name is Tricia Zizumbo. I'm the Director of Training here at Oakland Community Health Network. Did want to let you know that this webinar is being recorded, and we will have it linked on our website. We will go ahead and make sure all those links are put in the chat. Feel free to use the raise your hand feature to ask any questions throughout, or the chat feature. We have 3 different presenters that will be able to take you through this information and answer any of your questions. So with that, I am going to turn it over to Jody, Melissa, and Sarah. Thank you.
Good morning, everyone. Welcome to our third webinar that will focus on reentry and community corrections, which are Intercepts 4 and 5. Next slide, please. Oh, no, I'll do this one. Okay, my name is Melissa Gregorio. I'm the REACH coordinator and one of Oakland Community Health Network's liaisons. I'm embedded in the Oakland County Jail, and my position focuses on connecting people to mental health treatment and providing resources and assistance. Sarah O'Brien is also embedded in the Oakland County Jail and is an Oakland Community Health Network liaison also. She focuses on discharge planning for individuals being released from jail. And then our last presenter is Jody Gornflow. She is the Oakland Community Health Network Probation and Mental Health Systems Liaison. Jody works directly with pretrial service investigators and with probation and parole agents, ensuring cross-system communication and information sharing. She will be talking about Intercept 5 today. Next slide, please. If you have been a part of our past webinars, this slide probably looks familiar to you. The sequential intercept model was created by SAMHSA through the Gaines Center over a decade ago. The idea behind the sequential intercept model is to provide a visual to help communities understand how an individual moves through the criminal justice system, but also how we as community stakeholders and providers assist them in potentially diverting a person away from the criminal justice system, or if they are already involved in the criminal justice system, to help them not further penetrate the system and to receive assistance and support. During this webinar, we will be focusing on Intercepts 4 and 5. Intercepts 4 and 5 play just as crucial of a role as the earlier intercepts, because this is where we ensure that the person is receiving the supports that they need as they return to the community. The overall goal with providing these supports is to ensure the person does not return to the criminal justice system and is assisted with their treatment. Next slide, please. Regardless of which intercept we are in, the providers play a very crucial role in the support that is being provided to the individual. Their role is so crucial because they are consistently involved with that person as they go through the model. One of the goals of the sequential intercept model is to decriminalize mental illness. Data shows that people that have mental illness are actually booked into the jail at a higher rate, and they stay in the jail longer than someone that does not have mental illness. Next slide, please. The best practices listed here are the best practices and key issues outlined by the Gaines Center for this specific intercept. Transition planning is a crucial step in working towards a person's success because it ensures that people have a workable plan in place to provide access to the resources that they need. Medication and prescription access upon release from jail is very important because when people are released from jail, they are provided or given a 2-week prescription to allow them to follow their treatment plans while waiting to get into their appointments with their provider, with their community-based provider. So we're making sure that they get that 2-week prescription during that transition period. And then we have a warm handoff to increase engagement because individuals in the jail are connected to a community-based provider while still in the jail. So as the reach coordinator, I can connect people to their community-based provider, or Sarah, the criminal justice resource coordinator, also can connect people to their provider. And at times we also can have their intake completed while they are still in jail if possible. And then with linkage to benefits, states are encouraged to suspend Medicaid rather than end Medicaid coverage while a person is in jail. This allows the person coming back to the community to quickly access important treatment services and medications because their Medicaid is still active then, or suspended but can be turned back on. Individuals are also referred to the Riker Center for assistance after their release with restarting benefits or applying for benefits and any other kind of assistance they might need. These are some of the best practices outlined by the Gaines Center, and we are focusing on those that we have here in Oakland County. Next slide, please. So this is my position, the REACH coordinator. I'm going to tell you a little bit about it. I've been in this role at Oakland Community Health Network as the REACH coordinator for over 4 years. So REACH stands for Rapid Engagement and Access to Community Health. So as I said, my position is embedded in the Oakland County Jail, and the focus is on jail reentry. Prison reentry is usually handled by the Access Department, depending on their needs. But for this Intercept, we will be focusing on jail reentry. So I receive referrals from several different sources to provide mental health screenings to individuals that are in the jail to determine eligibility for mental health services in the community. So I will go and meet with the individual and do the screening to make sure that they're eligible or not. The referrals can come from jail caseworkers or from Sarah, the criminal justice resource coordinator, or Jody can send them in different avenues. I can meet with people up to 45 days before their release from jail to screen them and determine their eligibility for mental health services. If the person is found eligible, they are connected and open with a provider of their choice, and an intake is scheduled for them. So individuals must be an Oakland County resident with active Medicaid or eligible for Medicaid. So even if they don't have Medicaid, as long as they're eligible, I can screen them. If a person is found not eligible, or they have private insurance or live in another county, they are provided with resources, treatment options, and contact information for the county that they live in to connect with mental health services. I also work with individuals to remove potential barriers they may be facing, such as assistance with connecting them to Hope Shelter if they are homeless, providing them with food and clothing, connecting them with resources in the community, and then I can also provide them with bus passes if they are needed. In my position, I coordinate with jail caseworkers and the providers to ensure that the person has a supportive reentry plan. So that's where that warm handoff comes in. So making sure that that person and any barriers that they're facing, that they're taken care of and assisted in those areas, and so that they have that smooth reentry plan. Once the individual is released, I do contact them and I do short-term follow-up with them. I will confirm their intake appointment with them and also provide them any support or any resources that may be needed, and just continue to talk to them a few times just to ensure that, you know, everything is taken care of and if they need any assistance with anything. With the COVID pandemic, things have been a little bit different in the jail. I was meeting with people before the pandemic face-to-face and engaging with them, but now we are doing it by video at the jail. So things are a little bit different. So we do the video conferencing. At times, if a release is needed to be signed, I will meet with that person still, though, in person. So that's about it. Now I'm going to hand it off to Sarah O'Brien for the next slide. Thank you.
Melissa, can a second to see if anybody has any specific questions for you and for this section.
Sure.
All right, if you have any questions for Intercept 4 and for Melissa, I did put quite a few links in the chat, but feel free to add your questions in the chat or unmute and ask any questions that you have. And if we have no questions, then we can move right on to Sarah.
Thank you.
Okay, so hi everybody, my name is Sarah O'Brien. I'm the Criminal Justice Resource Coordinator, and my role is also embedded in the Oakland County Jail, and I focus specifically on jail reentry. So I serve as the liaison between the providers and the individuals at the jail. So when coordinating with providers, I can provide any updates or help answer questions surrounding things such as booking dates, release dates, any upcoming court hearings, the outcome of those hearings. I also meet with people who have been referred to psychiatric services while they're in the jail, and we work together to create a discharge plan before they're released. So first step is when somebody enters the jail, we identify if they're already open with a provider network. I do a manual search of everyone that's booked into the jail, and I cross-reference that with our medical record system to see if anyone's currently open with mental health services while they're in the community. I also check if they've ever been open with services, and if that's the case, they might be interested in returning. So if they're open with a provider, I reach out to the assigned caseworker and I notify them of the arrest. We discuss any information related to the case, answer any questions, and then I begin gathering some of that information that we use to create a discharge plan. At the same time, providers have really been an integral part of helping me identify individuals that are in the jail. So having that communication going both ways really closes those communication gaps between the individuals, their providers, and the legal system. So for example, if a person no-shows their appointment with the caseworker or their therapist, the provider might know that this person had a court date coming up and now they can't get in touch with them, they're not answering the phone. That provider can go online. Oakland County Inmate Locator is just a public access website that anyone can go on and see who is currently in the jail. So providers sometimes will go on there and see that their person was booked in, and then they'll reach out to me. They've done a really great job of staying engaged with individuals, not only while they're in the community, but also by following up and continuing that engagement while the person is still in the jail. So if a provider knows of someone in the jail or thinks someone may be coming to the jail, they can always reach out beforehand too and let me know so we can begin that planning and get them connected to services as soon as possible. So before the pandemic, the jail would also allow the professional visits for providers, and we would have 2 visits for every individual that was in the jail. So once at the beginning, so the caseworker could come in and make that initial face-to-face contact with the person, and then right again before they're released to finalize any last-minute details of a release plan and create that warm handoff to their provider in the community. This is one of the key elements, that warm handoff is one of the key elements for Intercept 4. And we know that those face-to-face interactions are critical to building relationships and engaging with individuals and their providers. With the pandemic, those visits now look a little different. However, despite all the challenges that we've been thrown this year, I think it's been really refreshing for everyone to see that we're still able to come together and make it work. Aside from manually checking the jail census and then having the caseworkers notify me as well, I also get referrals from Easter Seals Jail Services Program. And Easter Seals is the mental health provider inside of Oakland County Jail. So every person that receives psychiatric services at the jail also gets referred to me for the resource coordination. I meet with those people, I explain OCHN services, I offer access screenings. We discuss connecting to services. If they're out of county, I'll give them information on how to get set up in services wherever they're living. If the person is an Oakland County resident and they're not open with services, they're referred to Melissa so an access screening can be completed, and then she would schedule that intake appointment before they're released. If a person is currently open with a provider, I will contact that provider and schedule aftercare appointments with their case manager. So they really have that warm handoff, and they always have an appointment set up before they leave the jail. Usually these appointments will occur within the first 3 days of their jail discharge. So that really closes the gap between the time that they have leaving the doors of the jail and then walking into their appointment. And the way that they're notified of those appointments is I put a little reminder note into their file at the jail. So when the deputies are booking them out, they'll give them a envelope with all of their information in it. So pre-pandemic, I used to complete this discharge planning piece in a group setting, but since the pandemic, we've switched it to one-on-one meetings. So someone has been unexpectedly released, for example, if they went to court, maybe the charges were dismissed, they still are able to get that same information packet that I used to give in my group settings. So we would just send that information in the mail to their last known address. And now that we're doing the discharge planning individually, I found that we're really able to focus more on a specific plan for that person. Usually in the groups, I would give just like a basic general overview of services and resources in the area. But if there was somebody that I identified in the group that might benefit from additional meetings, I would then schedule time to meet with that person and go over any questions they had specifically. But now that we're able to do it one-on-one, it's really been more tailored to fit their needs, which is nice. Some of these things that we talk about could be anything from social services benefits, physical health, employment, housing, food, clothing, shelter, prescription assistance, all of those things. So anything that they are asking referrals for or information that they need, I then collect all of that information, put it in a folder, and then I put it in that file with their prescription and their appointment reminders. So everything is collected into one place for them and given to them as they're walking out the door.
Sarah, I want to interrupt you for 1 second. I want to make sure we're on the right slide.
Nope, I'm still on the last slide.
Okay, thanks.
Yep, thanks. All right. So as I'm talking to people about these benefits, about resources that they may need, the Riker Center usually comes up. So the Riker Center has been a huge part of helping individuals at the jail get connected to some of those benefits. Even though our current laws don't allow for a person's benefits to remain active while they're in jail, Michigan does have some pending legislature out there that we are continuing to monitor, and it's looking to change that. So eventually a person may be able to apply for Social Security or Medicaid while they're still incarcerated. But until that day comes, we refer to the Riker Center for assistance in beginning that application. And then once they're out, the Riker Center will follow up with them to help complete it and get everything submitted and turned in. So if you are not familiar with the Riker Center, I know Tricia put the link in the chat earlier, but they're located inside the Resource and Crisis Center in Pontiac, and they have case managers on staff to help with benefit applications or managing all of these systems and referrals that individuals may need. So it is located on the same complex as the jail, which is really nice. So before the pandemic, individuals could just walk over there for assistance. But with the pandemic, we've had limited ability to meet in person. So the Riker Center has really been great in helping out whenever we had a referral, and they've been doing things virtually or by phone with us. So that's been wonderful. As mentioned before, every individual is provided with a resource folder as they're walking out the doors of the jail. So that outlines their discharge plan and their appointment reminders. We also include a prescription in that folder of any medications that they had while they were in the jail. So I work closely with the psychiatrist at the jail to request any out scripts for a person that might have an upcoming release date, or maybe they're going to court and they think they might get released. We put a script in their file just in case. And that prescription is 14 days worth of medication. It can be filled at any pharmacy that they choose. So they're given all of the information on that. SAMHSA is identified as having access to medication until a person's able to meet with their community provider as one of the key elements for diversion at Intercept 4. So if a person's released and they don't have Medicaid, it would be hard for them to get that prescription filled. But with the jail system, we have individuals are given a specialized code, and there's a pharmacy network program that will fill that prescription for free. So as long as the person has insurance, they can take their script, get it filled. If they don't have insurance, we give them a code and a list of pharmacies that participate, and then they could take it to one of those pharmacies to get their meds filled for free. It's just a one-time prescription, just one-time code. So all of those pharmacies are located inside of Oakland County. So normally if there's somebody that I know that lives out of county or isn't really sure where they're living after jail, I always make sure to let them know, stop at one of these pharmacies if you're not sure if you have insurance or not. Because if you think it's on and it's not, at least you're in the right place. So overall, the reentry piece of the sequential intercept model really strives to connect individuals to some tangible resources and partners that all work together and share in the same goal of reentry and diversion. And specifically, Intercept 4 shows that planning for reentry as early as possible, providing the access to this medication, initiating those warm handoffs, connecting to their benefits, all of those things really contribute to a successful reentry. I'm happy to serve as a point of contact for any questions for providers or anyone else. If you know of individuals that might be coming into the jail or people that are already there and they might benefit from this release planning, please let me know. Reach out. Phone, email is always great. But that is all I have for this one. So next slide.
Okay, so here is where I will take over. My name is Jody Gornflow, and I am the Probation Mental Health Systems Liaison, and I'm going to talk about, excuse me, Intercept 5. It is called Community Corrections. Policy Research and Associates identified it as Community Corrections as part of the national model. And I just want to give a disclaimer that in Oakland County, we actually have a division called Community Corrections that is part of pretrial services. And so I don't want anyone to get confused that community corrections proper is part of this intercept. That's actually an earlier intercept, but for the purpose of the model, the sequential intercept model, SAMHSA has identified it as community corrections. Really, it focuses mainly on probation and parole reentry. So SAMHSA has identified some best practices in this intercept, and one of them happens to be specialized community supervision caseloads. Basically, what that means is that they recommend that probation officers and parole officers, case managers in that kind of capacity, that they potentially can be trained, that they can have specialized caseloads that focuses on certain populations. In parole, for example, they do this, and they don't particularly do this focused on mental health or behavioral health services, but they have parole agents who have certain populations on their caseload. Let's say they have a sex offender caseload, or they have a caseload of individuals who have alcohol issues, who are on alcohol tether, that kind of thing. So they identify this as being really important and being able to provide additional support that helps those particular probationers or parolees sort of move towards their recovery and just increase access to services and appointments. And they hope, reduce the amount of jail and prison time that individuals are returned to due to violations. So the second best practice happens to be MAT, medication assisted treatment. And medication assisted treatment is something that we do here in Oakland County, and it is an approved disorder, and it's approved, and I can't think of the word. It's approved by SAMHSA as being a valid substance use disorder program that combines behavioral health therapy and the use of medication to treat substance use disorders. And so we can really do this by connecting with individuals, by identifying individuals, and then connecting them to medication-assisted treatment in our jail. We want to reduce the amount of risk that individuals face when they're released and we want to make sure that they have access to those medications. It's really important to the continuity of care, especially for individuals who are participating in these services before they went into jail, or just individuals who may be somewhere in the roller coaster of participating in these services. They may have an opiate use disorder they're using in the community. They have been identified as someone who was participating in services, maybe isn't right now, maybe they were at some point. So we want to make sure that that continuity of care sort of continues. We always want to make sure that individuals have access to recovery supports. And this includes housing. We want to talk about employment. We want to talk about helping individuals get vital documents, helping them connect to the things that they need on the outside when they are released from jail. Probably a little bit less prison, because in general, the prisons have individuals whose job it is to focus on helping individuals get their vital documents before release, but this is just part of it as well. We want to help them, get healthcare coverage, apply for Medicaid. We want to help them figure out how to potentially get some legal assistance and exploring expungement, those kinds of things. We always want to promote information sharing. That's another best practice, and I'll talk a little bit more about that in a few other slides. And, performance measures. We can look at the processes that we perform, and, we can make sure that the services are efficacious, and that, we evaluate the data and we develop responses. So, our liaisons and a lot of our positions from our initiative and our justice team, they're really focused on these performance measures. We all track data. We all have data. We track it, we analyze it, and we develop responses that are based on those data and those performance measures. Next slide, please. So we do have a liaison who came on board this year, and her name is Michelle Monfortin. She's our behavioral health systems liaison, and she is focused on our contract with Michigan Department of Corrections for substance use disorder services. And so this year we entered into a contract with Michigan Department of Corrections to provide the substance use services to individuals that are referred by MDOC. And so she assists those individuals who are on probation or parole through MDOC and who need those services. She coordinates with our access department regarding access screenings, and then also our readmits for individuals who were in services and that need to be readmitted to services for higher levels of care. She provides a ton of case consultation to parole and probation officers to support the resolution of barriers to treatment. And she does, the same thing. It's really about bridging communication, bridging those understanding gaps and service gaps across the system. And so she is, she has a very big role to play when it comes to MDOC, and she is our go-to person when it comes to individuals who are participating in substance use services contracted through Michigan Department of Corrections. Next slide, please. So this is my position, and my title is Probation Mental Health Systems Liaison, and I am essentially a liaison for probation and parole agents in Oakland County. My job is to promote information sharing, and I do that quite a bit. I provide case consultation, which I'll talk about in just a moment, and I'll kind of give you some examples of how I promote information sharing. I provide updates to the provider network. I do this quite a bit. This is a really big part of what I do. So I get emails and calls from particularly a lot from pretrial services, and pretrial services, they have an investigation unit, and they are specifically tasked with interviewing individuals who are arrested in our county. So individuals, let's say, that get arrested in Troy, individuals that get arrested in Auburn Hills, individuals who get arrested in any jurisdiction in Oakland County. when they end up in custody, some of them are identified as individuals who need to have a pre-sentence or a pre-trial investigation interview. And so those investigators, they meet with the individuals wherever they are, either in local lockups or at Oakland County Jail, and they potentially identify the idea that they have mental health concerns, substance use concerns, or that they are currently open with a provider. This is what happens, I think, more than anything, is that an individual is already open with a provider, but either they didn't tell the pretrial investigator that, or they didn't want to disclose it for some reason, or potentially they were in a position where they just couldn't remember, or for whatever reason they were upset, they were arrested. It's very stressful and traumatic. And so they alert me, and I look them up in our medical record system. And some of you may have already gotten calls or emails from me in the past, just alerting you that you have an individual that's in the jail, that's in local lockup and potentially will be transported to the jail. And then I let Sarah know. I will typically send Sarah an email, or I also coordinate with Melissa to let them know that there's individuals that have been identified as having serious mental health concerns that either are already connected, already have a case manager, or that potentially need realignment with services. I also offer case consultation, which I think is another big part of what I do. I do this with providers, all of our justice partners, which includes judges, probation and parole officers, family members, attorneys, and any other interested parties. I get a lot of calls from family members who would like to know what's going to happen next. They have an individual who's in jail or that is potentially going to prison, and can you tell me what's going to happen next? So I spent 10 years working as a probation officer, so I'm very familiar with the court system, and a lot of times that case consultation is really just about providing the information about what's going to happen next. So anytime you have an individual that ends up in jail, or even an individual that has an upcoming court date and they don't understand what it's for, they don't know what could potentially happen, please feel free to reach out to me, to give me a call, to email me and say, hey, Jody, can you kind of tell me what I can expect next, what the individual can expect next? Their mom called me and wants to know what's going to happen at the next court date. Individuals oftentimes get referred for forensic exams. That's a really confusing process. And it's also, I don't want to say antiquated, but it's a process that sometimes takes a long time. So that is sometimes confusing as well. People don't understand what it means to be in limbo, what's going to happen, why are they just sitting in jail? I also give a lot of case consultation about bonds, about what does this bond mean? How are they going to be able to pay it? What does it mean if they have a hold? So anything that has to do with the court system, I potentially can translate what is going to happen next, what can be expected. I can never predict what a judge is going to do, but I can always let you know what's going to happen next in the court process. What is the next hearing? What can the individual expect at the next court hearing as far as the process goes? So I would just encourage you to always reach out to me if you have questions about that. We also can talk about calling the court and what you can ask the court, what kind of language to use to get the information that you need. I'm always available for case consultation when it comes to that, because my goal is really to reduce violations. We don't want individuals violating their probation or parole based on things that they cannot control. And we also want to help them provide or prevent further criminal justice involvement. And in general, we just want to help improve outcomes. Next slide, please. So this is a really important slide when it comes to the providers. This is really focused on treatment support, and treatment support is really important. It's crucial for individuals who are on probation and parole, because a lot of times their probation officers and their parole agents, they require documentation of their case management or treatment. And so I cannot stress this enough, how important it is to maybe communicate with individuals that you have on your caseload and talk to them about what their probation officer or their or their parole agent expects from them as far as treatment documentation, because a gap in the communication can lead to violations, technical violations, because really that violation, if an individual you have on your caseload is participating in treatment and they're compliant, it's a shame for them to violate their probation or their parole and potentially suffer punitive measures like going to jail or returning to prison because of something so technical. Now, a lot of times this communication gap, and I'm going to finish off with information sharing in the next slide, but a lot of times this gap, and we know how this works, we understand how HIPAA works and 42 CFR works, and we know that a lot of times this gap in communication occurs because the individual doesn't have a release of information on file for their parole agent or their probation officer. So I would just encourage, when you have individuals who you know have justice involvement, to just go ahead and have them sign a release of information. And we encourage probation officers and parole agents, when we go out to train them and when we have meetings with them, we encourage them to say to their individual, hey, make sure you tell John Doe when he goes in to meet with his case manager next time to please let me sign a release of information that includes my probation officer. That can be a really crucial element to that information sharing piece. Now, a lot of times I imagine as a provider, you get phone calls and you get phone messages or emails from probation officers or parole agents that want to talk to you, that want to tell you something, or that want to get some information. They want to find out if John Doe is participating in treatment. And obviously you can't share if there's no release. So that might be a really good time to just go ahead and have that individual sign a release of information. Now, I know with COVID, most of our appointments are taking place via telehealth. And so, you just have to go with your agency's policies and procedures in regards to signing release of information. And I think that, again, I cannot stress this enough, because I feel like this is the number one barrier that I get calls about is, please tell me what's happening. John Doe is about to I'm about to issue a probation violation because I haven't gotten a treatment report in 3 months. And there could be a number of reasons. It could be because the individual didn't want you to share that information. It could be because they weren't participating, they weren't being compliant, and there's no release on file. But everything that we can do to encourage information sharing and make that smoother, then we're kind of on the road to reducing violations and reducing those punitive measures. Next slide, please. And so this is really the release of information. We make this like an entire slide because it's just so important to talk about. It is crucial, again, in information sharing. It's crucial in the reentry, the probation, and the parole phases. Think about who can be included on the ROI. This is really important. When you meet with somebody and and they told you, oh, I got arrested 2 weeks ago for breaking and entering, and you can potentially see that they have some court dates coming up. It's a great idea to ask them, do you know what court you're going through? And they say, yeah, I got arrested in Clarkston. And then you can look up that Clarkston is the 52-2 district court. It would be a great idea to go ahead and put 52-2 district court right on that release of information if you know that there's potentially information that you want to share. Individuals who end up in Oakland County Jail, if they have psychiatric involvement, they will go, well, I shouldn't say psychiatric involvement because that's Easter Seals and the psychiatrist. I misspoke. So if an individual ends up in the jail and they have been identified as having mental health issues through their screening tool, then they're referred to our sheriff program services, and those are caseworkers. It's a civilian unit. They're employed by the sheriff's office, so they're actually not our employees, but they are the ones who identify individuals, and they have a system of triage, and then they refer individuals who need mental health services directly to their caseworkers, and they have their own case management system. And so this is also crucial for individuals who go back to Oakland County Jail on violations. You might have someone that's on probation or parole, potentially, probably probation mostly. And if they have a probation violation and they end up in the jail, then it is a good idea to think about if they know they have a court date coming up and they're potentially facing jail time, maybe you want to go ahead and throw Oakland County Jail onto the release of information and have them sign it before they go to that court hearing, so that you know if they end up in jail, you can share information for that continuity of care. Michigan Department of Corrections. So if an individual is sentenced for any kind of felonies, they will go through the Michigan Department of Corrections through probation or parole. Parole is obviously individuals who are re-entering from prison. District courts, I mentioned Clarkston was just one of them, but you can look up, you can Google any city where an individual was arrested for a crime, and it'll tell you the corresponding district court where that happened. You can include the judges, the probation officers, or other court staff. In general, it would probably be the best idea to include the court. So if they got arrested, let's say in Oak Park, you would put on 45th District Court onto the release of information. You could include the attorney on the case if they wish for you to include the attorney. I get calls from attorneys who'd like information, who would like some kind of care coordination for individuals who they know have a provider that are participating in services. And of course, I can't share information unless there's a release on file. And family members or any other interested parties, guardians, obviously you want to make sure that people that call, if your individual would like you to be able to communicate in regards to that, that you put them on the release of information as well. Next slide, please. So I just want to finish by saying, these are outcome goals. For anybody who's been in our previous webinars, all of our liaisons on the justice team, we have the same goals. We want to reduce the number of law violations by individuals that have behavioral health disorders. We always want to help shorten the length and the intensive of punitive measures, and that includes jail time, community service. It could include anything punitive, but we especially want to keep individuals out of jail and prison for simply having mental health or behavioral health disorders. We want to increase our service and support connections for those that are re-entering the community. I mean, besides reducing violations and helping shorten punitive measures, every single liaison we have is focused on support connection. We want to help people meet their basic needs in life. That is what we are here to do, is to help them figure out how to make those basic need connections: food, housing, shelter, employment, resource connection to benefits, applying for Medicaid, absolutely anything that we can help them connect to help further their life goals. That's what we're here to do. And we want to help individuals obviously on probation and parole that have mental illness or substance use disorders. And in the end, this is a goal to reduce rates of recidivism. We don't want people committing crimes based on the fact that they cannot meet their basic life needs, or that they simply have mental health illness, that they have substance use disorders that are not being addressed in the community. Next slide. And that is it. That is what we have for you today in Intercept 4 and 5. This is our contact information for myself, for Melissa, and for Sarah. And if you have any questions, please let us know.